When I was a college student, I came to Boston with my cousin who was looking for a place to live. She was going to law school up here. And we were looking in Beacon Hill and I saw MGH. And I thought, oh my gosh, it's Mass General. And I'd always heard about it. And I insisted that we detoured so they could walk through the lobby because I always revered Mass General. And I remember looking around and my jaw just kind of dropped and thinking, oh my gosh, one day I would hope to work in a place like this. My name is Dr. Beverly Moy. I'm the clinical director of the breast oncology program at the MGH Cancer Center. Much of the research that has really exploded over the last several years has actually started at Mass General, which I think is really remarkable, and we're so proud of that.
It is one of the greatest places to be a doc or to be a clinician. First and foremost, you have to prove yourself by taking care of patients and taking care of them in a way that everybody will feel comfortable sending their own family member to. So we have the mother role at the General, which is if you don't take care of somebody the way you'd want your mom taken care of, then you don't really belong here. And that's the expectation, and it's the expectation that gets handed down generation to generation.
My name's Laura Riley, and I'm a high-risk obstetrician here at Mass General. I knew from day one that I wanted to be a doctor. I was about, I'd say maybe 9 or 10 years old. I was going to be Marcus Welby if it killed me. The exciting part of it is when you can help deliver a baby who the parents thought wouldn't survive. Or, you know, a woman who had cancer during the pregnancy, and so, you know, she had to have radiation and chemotherapy, and then you deliver this beautiful, healthy baby. And so, you know, being part of those experiences it's not quite Marcus Welby, but it's really, really special.
Every individual here, in their own way, helps to support and maintain this culture of putting patients first. And it's reflected in the eyes of the patients who come here, who can tell that they've had an extraordinary experience here. They leave here feeling that they've been taken care of well.
It really is remarkable and inspiring and fuels you, frankly, to keep at the work at all hours and nights and weekends included. It's an incredibly supportive environment.
Mass General Hospital is a world leader right now in the field of human genetics. My research is basically trying to figure out why people have heart attack at a young age. And that sequence information is giving us tremendous insights into what are the causes of heart attack and other diseases like diabetes. Investigators like myself and Mass General really do think about what are the big questions, how can we answer them, and this place facilitates our ability to ask and answer big questions.
These families, these kids are the bravest of the brave. Well, they always ask, is it going to hurt? Will I glow in the dark? Because, you know, they've heard of radiation and all those superheroes, and they want to know, are you going to glow in the dark? And we say, no, you're not going to glow in the dark.
The wonderful part about protons is there's actually no exit dose, so there's no dose that goes on the other side. And so that means that when you're treating a child with a brain tumor and you have all of those growing tissues, when you're targeting the tumor, you will get the entrance dose of radiation, but no exit dose to the surrounding brain, and you would be able to spare at least 50% of the brain dose of radiation to that part of the brain that you'd otherwise get with conventional treatments.
When you take care of patients who are treated with proton therapy, what's absolutely amazing is when you see them on a weekly basis to see how they're doing, they rarely have side effects.
And we can see what the quality of life is, and it is unbelievably different.
You see them long-term, they haven't developed long-term side effects, is the most rewarding experience of my professional career. That means for patients a much higher probability that they can live a normal life.
And now we've treated over 1,000 children worldwide have come here to Mass General for treatment with protons. The results have very much lived up to that initial promise.
All people who finish their treatments ring a bell that signifies they're done, and it's the good luck bell. It's great to see those little ones ring the bell.
That's the reward of proton therapy.
Meredith was the 28-year-old girl who ended up having heart failure through no fault of her own. Her family showed me a lot of pictures. She had this big photo album her mother had made. You know, just her growing up, vacations, things like that. And, you know, one of the first things they did was show me her and her life. And in every picture, she's just like, you know, vibrant and happy and alive. You know, her independence had just been completely taken from her, and she was just so weak. Her voice at times was just a whisper, and you could barely hear it. And she was pretty tired, and she just goes to me, "I just want to tell you about my wedding." And I'm like, oh, you know, just, I'm like, yes, tell me about your wedding, you know. And she's like, you know, it's gonna be in the mountains. It's gonna be in the up in New York, and I'm gonna wear a lace dress and cowboy boots, and my mom's not gonna like the cowboy boots. And you know, the whole time I'm just trying not to cry and just, you know, running these machines that were keeping her alive. I just loved hearing about her future and that, you know, she was wanting that. Those such normal things. I can just imagine it was so hard just to be, you know, healthy and then be so sick you can't do anything at all for yourself, at all. One day I took care of her and I'm like, you know, let's wash your hair. So I got a bucket, you know, I'm just kind of getting her hair really wet, washing her hair. She's a nice shampoo, you know, smelled really good, and washing her hair. And I put the music on, and you know, I started dancing, you know, just kind of having fun with her. And she starts kind of shaking her shoulders, and she's kind of moving her head. You know, she's like dancing as much as she can. She can't move her legs and she can't move her arms. It just made such a difference to her that day, having as much fun as we possibly could in the ICU. She just loved my shampoo. It doesn't feel like work when you're able to just love the patients and give them that extra time and attention that they so desperately need just to feel any sort of normal. I wanted her to get a heart. I wanted her to be healthy. I wanted her to be better. And the process of, you know, getting the right heart to the right patient is very lengthy and very detailed, as I'm sure you can imagine. So nobody really wanted to get their hopes up too much. And then we start hearing some chatter about this heart that's maybe available. And, you know, the buzz is all around and everyone's so excited, but, you know, you don't want to get too excited because, you know, things aren't for sure until they're for sure. And 3 days after a heart transplant, you can expect the patient to not have the breathing tube in, be doing really well, maybe in the chair even,
looking more like themselves. And when I came into work that day, there were 2 nurses taking care of her because 1 nurse wasn't enough because her bleeding was so severe. She was not awake. She was nowhere close to being awake. She was really close to dying. I remember feeling so disappointed for her. But having to just completely push that aside and push all of those feelings aside. I went into the room, I put my phone on my iTunes running mix, and I just blared it, and I just worked all day, all day. I had to put myself in the zone. I mean, there was one point where for 2 hours we were doing surgery on her in the room. And it, you know, they just couldn't find a source of bleeding. If you can't find the bleeding, you can't stop it. If you can't stop the bleeding, we got through the night, barely. They found the source of the bleeding, thank gosh. Well, you try not to let it get personal. But once it's already there, the biggest thing that helps is just venting to my coworkers and them venting to me, because really these are the only people that understand what you're going through. Of all the things, I really can't say enough about the nursing care here. These people who I work with every day care very much about their job. They care very much about doing it well, doing right by the patients, doing right by their families, giving them the dignity that they deserve. Her prognosis is very good. From now on, her future is very bright.
Oh, it just is so amazing to see them in street clothes and, you know, not sick and being healthy. It's like, ah.
When Hurricane Katrina hit down south, and the first night that we got there, we were basically thrown off the ship and told that we had to go out to find a place that we could set up a clinic. So once we got out on land, we found an abandoned mall area that had shops and stuff that were no longer in use, and staked it out and thought that this would be an ideal place to set up clinic. Within a matter of 8 hours, we were able to start seeing patients and take care of them for whatever issues they were having at the moment. We were equipped and ready to go and take care of them. And it was really exciting to do that. So I wound up in Haiti probably about 2 or 3 weeks after the earthquake happened in a place called Deschapelles. And there I changed my hat from a medical nurse to a social worker, a case manager, a bank. Anything that you can possibly think of, I became it. When we go on missions like these, this is the expectation, you know, you never know what's going to happen or what you're going to get thrown into, so you always have to be ready and willing to do whatever you can at the moment. I've been to Banda Aceh, I've been to Bangladesh, I've been to East Timor, I've been to Africa, to Ghana and Liberia. I was also in Suriname and Guyana. My name is Joy Williams. I'm a registered nurse, a staff nurse, Mass General Hospital Interventional Radiology Department.
I went through 11 years in various training positions and locations. In 2003,
it led me to a tour in Iraq. Assigned to the 1st Infantry Division, and I came home February of 2005. I found myself trouble with finding employment, being able to keep a job. Found myself excessive drinking, finding anger and mood swings. It's hard to talk to somebody outside of the spectrum who physically has not been in a position of seeing the things that the men and women going overseas actually see. Everyone may say I know, you know, I understand, but in actuality, they don't. They don't know what's going on deep inside. I had my son when I was 21. I was afraid that I was going to lose him. It scared him, it scared my brothers, it scared my parents. For me, that's not a way to raise him. So I took the step and I made the phone calls to the home base program. I didn't really have anywhere to turn to until someone told me about this. But it seemed as the sessions went on, I opened up more and more. I learned a method to use an on-off switch where certain situations that would arise, I had to learn to be able to shut that switch off. I knew at that point that I really wasn't alone with things that were going on, I guess dealing with my own demons. My son, he's 12 years old now, my pride and joy. I now have a daughter. The things that I see and that I've worked for, to be able to put a smile on their face, keep me going every day. Being able to walk on that field and participate in an event that happens at every game, it was an honor.